Thank you to Pathpresenter for this online case of lichen sclerosus. The last part of sclerosis is S-U-S, not S-I-S, just FYI. Lichen sclerosus traditionally is seen in postmenopausal women in the vulvar region, known as like tissue paper, kind of like skin. Although the exact mechanism of what causes it is unknown, it's thought to arise from autoimmune conditions. And before we delve into the histopathology of lichen sclerosus, I just want to emphasize that if it looks like lichen sclerosus and it's not in the vulvar, that's probably lichen sclerosus, because you can have extragenital lichen sclerosus, and it can also happen in kids as well. All right, so July 4th is coming up, and like July 4th in America, lichen sclerosus is red, white, and blue, the traditional form. So red is the compact hyperorthokeratosis and the hyperkeratosis here. I say ortho because you don't see any parakeratosis. You don't see any nuclei in the stratum corneum, right? And then the white is not the remaining epidermis, but the papillary dermis and the superficial reticular dermis right adjacent to the epidermis. And it's the buzzword is homogenization. And you can appreciate how compared to the reticular dermis here, that's pink. This is white. And then lastly, as you probably correctly guessed, the blue is the lymphocytes that we see here, the driver of this inflammation, all these lymphocytes attacking the keratinocytes. You can see dyskeratosis, which is meaning like the dead keratinocytes from the action of the lymphocytes. Although I don't necessarily see a good dyskeratinocyte here. But it's also important to be aware that sometimes you might not get a sample that's perfect like this. You might just get, like in my experience, just even like a little sliver like that. And it's also, and even if it's a little, it's important for you just to keep in your mind lichen sclerosus, no matter how scant the sample. And timing matters too, because imagine you got a biopsy that is the very beginning stages of lichen sclerosus. You don't have time for that homogenization to develop. The lymphocytes are abutting the epidermis, the basal keratinocytes, and the basal cells, and you just might see red and blue. So just something to note. And then you also might have like a burnt out lichen sclerosus where the lymphocytes aren't as prominent, or might not even be there at that stage. Lastly, lichen sclerosus, why do we worry about lichen sclerosus? Is it due to the symptoms, pruritus, being uncomfortable? Of course, and that's very important. However, it also increases your risk of squamous cell carcinoma. What can drive squamous cell carcinoma in the vulvar regions is also HPV. I want to emphasize that these are two different pathways. Lichen sclerosus leads to something we call DVIN, or differentiated vulvar intraepithelial neoplasia. And that ultimately, and that's what we call is dysplasia, it's precancer. And then that can lead to squamous cell carcinoma. That's driven by an HPV independent mechanism. I find DVIN very, very hard to diagnose. But some histologic findings are some increased basilar atypia, where the basal keratinocytes will have a higher NC ratio. They'll be hyperchromatic, and if you get a p53, they will be aberrantly expressed. So that's a very important point to note as well. All right, I will see y'all next time.